I would say first and foremost that current societal guidelines indicate that they are appropriate for colon cancer screening, now based on the newly adjusted age to 45. So if they are an average risk individual, meaning that the patient has no personal or family history of colon cancer, has no personal history of colon polyps, is not having any symptoms that raise concern about colon cancer, change in bowel habits, new onset constipation or diarrhea, blood in the stool, and the patient has no predisposing disease state like chronic inflammatory bowel disease. If you exclude all of those things, the patient is average risk for colon cancer and should be screened beginning at age 46. I would strongly recommend colonoscopy as the preferred method, and that is because what I really want to know about that patient is whether they're forming precancerous polyps at that young age, to identify those polyps and remove them, so that not only can I make a risk assessment for the patient going forward, but I also have the opportunity to change the natural history of the disease for that patient by removing precancerous polyps. If that patient has a Cologuard test and it's negative, all I really know is that there's a pretty good likelihood they don't have colon cancer. I also know that there's some likelihood that they don't have precancerous polyps, but the ability to detect precancerous polyps by Cologuard is very, very small. And so I actually don't really know whether they have polyps or not overall. And if they were to stick with that strategy and I was recommending a Cologuard 3 years later, I would feel like I hadn't really done the very best colon cancer screening test for that patient.